Heart disease is the leading cause of death in the United States, but the generic term heart disease describes a number of diseases affecting your heart. According to the Centers for Disease Control, the most common heart disease is coronary heart disease, which often appears as a heart attack.
Heart disease, as we commonly refer to it, or coronary artery disease, is atherosclerosis, or cholesterol buildup inside the arteries supplying the heart muscle. So what happens is if it gets significant enough, people can get what we call coronary blockages or angina or heart pain, where they get exertional chest pain. Who is at risk? People with strong family histories, people with extensive smoking histories, people with high cholesterol, diabetics are in very high risk for it, people with hypertension that's been untreated. It is the #1 killer of men and women in this country. So in effect, all of us at some point are at risk for it, and it's just a matter of identifying what our risk factors are and then getting them treated.
It's estimated that in 2010, 785,000 Americans had a new coronary attack, and 470,000 had a recurrent attack. About every 25 seconds, an American will have a coronary event, and 1 every minute will die from one. The chance of developing heart disease can be reduced by understanding the signs and symptoms and taking steps to prevent and control factors that put people at greater risk. Some heart attacks are sudden and intense. However, most start slowly with mild pain or discomfort. Often people affected aren't sure what's wrong and wait too long before getting help.
With coronary disease, most people present with chest pain. People can experience things in addition to chest pain though, things like shortness of breath or chest pressure. When it comes to chest pain, we'd rather you err on the side of caution. We'd rather you come into the clinic and be evaluated and have a very non-heart-related problem than to miss something that could put your life in jeopardy.
We have a number of different options to evaluate people with chest pain to see if it's coming from their heart. We can do multiple types of stress tests, including stress tests with types of pictures, including nuclear pictures and echocardiographic pictures. We can look at their heart arteries directly, either with a catheter, which is somewhat invasive, or non-invasive with no catheters with a CT scan to look directly at the heart arteries.
Generally speaking, people with coronary artery disease are placed on aspirin. This aspirin helps make the platelets less sticky. That's one aspect. Another aspect is cholesterol control. And that, depending upon how much heart disease people have, we'll treat their cholesterol to different levels. The other things we would say are managing blood pressure or lifestyle effects such as exercise, weight loss. For diabetics, improved diabetes control is essential.
Heart disease can be prevented or even improved by making changes in your life. A healthy diet and lifestyle are important in the fight against heart disease. Be sure to read nutrition labels and make healthy choices.
A heart-healthy diet would be low in fat, generally would have very low red meat, it would be high in fish, whole grains, fresh vegetables, and low in saturated fat especially.
In addition to following a heart-healthy diet, not smoking, controlling your blood pressure, maintaining a healthy weight, and including physical activity into your daily life are all ways you can improve or prevent heart disease. If you're a man over 40 or a woman over 50 and smoke, have high blood pressure, high cholesterol, are obese, lead a sedentary lifestyle, or have a family history of heart disease, you may be at higher risk and may benefit from preventative screenings. For Ben Memorial Clinic, I'm Victoria Adelis.